Now, the Sisonke Study did an intensive research on the impact of the COVID-19 virus on healthcare. The co-principal investigator, Gail Bekker, joins us now for details on what they learned. Thank you very much for your time here on NewsLink. Now, firstly, is this part of the Sisonke project that actually took place from around February, I believe, last year, when our first doses of the Johnson & Johnson vaccine arrived in the country?
That's right, Maseko. So we finally got the initial primary paper published, and I think that's the news. So the Lancet published an investigation of those almost 500,000 healthcare workers who stepped forward for the single dose J&J. And we followed those individuals through the rest of the beta wave and into the delta wave. So we look at the performance of the single dose vaccination in the face of the delta wave, which was, of course, our third wave about 6 months ago now. So that data really shows that even a single dose of the J&J vaccine was very powerful in preventing severe COVID, requiring ICU or critical care and even hospitalization. So I think important data to get out there, because it does still show that even, if we can get that single dose to the rest of Africa, we can make a significant difference in terms of the onslaught of COVID. So an important intervention, I think, in low and middle income countries.
How effective was this? Because remember when it first arrived and it was compared for South Africans to compare between Johnson & Johnson and Pfizer, and we were all told that Pfizer would be the best option, it's a better option, etc. So are your findings agreeing with that? Is it less effective?
No, in fact, with that single dose, it does perform slightly less well than 2 doses to Pfizer. Remember, the single dose J&J was really put forward as an emergency intervention, something you could get out very quickly because it means people only have to line up once, and the protection kicks in within 7 to 14 days. So you really do get a very quick response in the face of the pandemic. We've recently looked at 2 doses of J&J against 2 doses of Pfizer, which also has been within the Sisonke setup, because we have now been able to offer those 500,000 healthcare workers a second dose of J&J as a boost. And what we've shown there, and that paper is under review at the moment, we've shown that actually the 2 doses are comparable to each other in terms of protection. So I think it is that, we were comparing a sort of single dose vaccine to 2 doses of another vaccine. But when you actually put 2 against 2, then they become comparable in their levels of protection.
So you said you did follow the 500,000 nurses and individuals for a couple of months after their first dose of the Johnson & Johnson. Now we're hearing talks, of course, of a booster shot, etc. Is that important right now for those nurses? I mean, if you got your shot in May, I'm assuming by now you must have had your booster. Is that still being emphasized?
Yes, I think so. I think, what has been the moving target for us, of course, is this virus and its ability to mutate or change. So it has been able to evade some of our efforts to block it with immunity. And what I think the evidence is now showing is that if you up your immunity by giving another vaccine dose, in other words, you train your immunity again, that adds further protection. So, we are advising people to go ahead and get boosted. Those are available. You can either now actually be boosted with a Pfizer or with a J&J, and that's very exciting, so that it means that individuals can make sure that they have the best protection available. So it really is about topping up immunity.
So you had 224,026 nurses and healthcare workers who were vaccinated, and about 3,215,000 who were unvaccinated at the time. How was the protection then? How was our herd immunity? I'm sure it was quite weak.
So at that time, we did not have the levels of background immunity that we do have now. So that obviously also adds into the equation, which is great. At that time, we had given almost 500,000 individuals the single dose, but the study looks at a subset of that, just over 200,000 people, as you note, who were in the medical schemes. So healthcare workers who also belong to managed healthcare, because we were able to then interrogate their databases to look at matched controls. So it's very important when we say, does this vaccine work? We want to compare it to matched individuals who didn't get the vaccine. And so we were able to do that in this study within the managed healthcare systems. And there we are able to show that there is very good protection, almost 85% protection against ICU, critical care, and death. And then, lesser 60 to 70% protection for those people to stop hospitalization. So, again, I think an important strategy for us all to think about in terms of providing protection against severe COVID. These vaccines, unfortunately, do not completely stop all infection, but they do reduce infection. And so, again, very important that we encourage South Africans to step forward to be vaccinated if they haven't had their primary dose, and to receive their boosters in order to be as well protected as possible.
All right, lastly, before I let you go, Prof, I mean, Johnson & Johnson was produced on our shores, so I'm assuming your findings are telling us that we should be proud?
Indeed, and I think also just saying that all vaccines are that are out, and certainly both vaccines that are approved by our regulator are good, they're protective, and the fact that we are moving towards being self-reliant in this country and on this continent when it comes to vaccines, I think, again, is something we should be immensely proud of. And I think this COVID-19 pandemic has reminded us all that we are able to hold our heads up high when it comes to research, to science, and to delivery of the best possible protections for the individuals who live on this continent.
Professor Linda Gail Bekker, thank you very much for your time here on NewsLink.